On occasion, we'll have a patient present with a retinal detachment and macular pathology, and this was just such a patient. Maculon, rhegmatogenous retinal detachment with a clear-cut epiretinal membrane and loss of the foveal contour. So we did a buccal vitrectomy. The detachment was inferior temporal. We'll see that here in just a second. Go ahead and stain with ICG. Very, very carefully aspirate out the ICG. And you can see the very nice negative staining of the epiretinal membrane here. We use our Max Grip forceps, which are a great do-it-all forcep here to get in and utilize a pinch and peel technique starting along the superior temporal arcade and peeling up through the macula. You can see here it goes off nicely. I like that little flick technique. That avoids me having to take my forceps out of the eye and wipe them on a chem wipe. And so if you have a forcep with a membrane in it, you can just take your light pipe and just quickly kind of flip it off and go about your business, and you never have to leave the eye, which is really nice. So this membrane comes up really, really nicely, and we can see I'll peel it out to the edge of the detachment, which is inside the macula, just on the inferior temporal edge. Nice, generous peel. Here's that flip it off, clean out that forcep, and I can peel a little bit further out. Now we're going to use perfluoron. I'll occasionally use perfluoron to reattach the retina. This one I did because the break was anterior and it was an inferior detachment. So I want to make sure we squeegeed out all of the fluid. I didn't want to make an inferior posterior draining retinotomy. We can see everything flattens out nicely. We use our laser probe here to demarcate our break. And then I like to use the cutter actually as I start out removing the PFO and the fluid. The cutter's nice because a lot of times there's very anterior vitreous, and you can use the cutter as you're going to air. And this case went rather well. Thanks for watching.